But there are pitfalls, I think, as we move in this area, and I do think that sooner or later we will be talking to each other in various venues beyond just walking down the hallway or beyond email. And I think some of the pitfalls are inadvertent disclosure to individuals other than healthcare personnel providing consultation. Security breaches at the online medical center. We've already seen that with some great institutions. Intentional deception online, right? On the internet, no one knows that you're not a doctor. And intentional disclosure by healthcare professionals to non-secure social media site. A really interesting case that you want to describe that you've been consulted on, and you might have enough information in there to make the patient identifiable, even if you don't violate HIPAA specifically with the protected health information pieces. So before doing that, I'd recommend thinking about how likely is it that an online consultation is going to produce an opinion that's better than those that are available locally. Would a secure email to a specific consultant be as effective? And certainly if you're going to use social media, consider using a secure, HIPAA-compliant, physician-credentialed, verified network site with secure transmission and communication. Again, I think we're far from that. It says, hey, since when do they have a university of HTTP, : in fact, there are some online universities, none that I know that you can get an MD from yet. But certainly case description shouldn't include any protected health identification pieces, and obviously you want to use as few details as possible that could be connected to a specific patient or individual to the info. This is, of course, if a patient has not given permission to be able to think about this particular case. Generally, patients would be happy that you're consulting someone else, and if a patient is open to disclosing information, there's nothing to stop that. But even a few salient details can be enough to identify an individual patient. Certainly would consult only with the minimum number of identified and verified physician consultants. And I think any online expert colleague consultation entails significant ethical and legal risk. So I'm not saying go out and do it, but I think eventually we will be doing it over secure networks with individuals who are identified that we're going to be able to consult with. Well, no question, Google and the internet has changed the doctor-patient relationship. Pamela Hartzband and Jerome Groupman certainly have summed up the fact that the web really is changing our relationship. One study that they cited was that Googling signs and symptoms gave the correct diagnosis in the majority of only 26, but published case records, so it's a little disconcerting to find out that Google is doing as well as Dr. Bell's followers. Remember Joseph Bell, the wonderful diagnostician whom Arthur Conan Doyle was a student of and then decided to make that wonderful diagnostician of crime, Sherlock Holmes. So we're wonderful diagnosticians. That's kind of what we are. And yet it turns out that Google seems to be able to get there halfway. But they point out in the article that information plus knowledge does not necessarily mean medical wisdom, and make a good argument that physician expertise and experience is going to be needed for some time. So one of the things that Tracy Miller and I wrote about was the difference between the online communication of information and when you've crossed the line into practicing medicine online. So you may be giving great advice on your Twitter account about things that you have opinions about in medicine, but when you start communicating with a specific patient about a specific problem and they're relying on that, just because you're not in the office doesn't mean that you might not be giving medical advice. So this problem, defining the practice of medicine online, is one that we can't go into depth into today, but there's no question that at some point information published by you on the internet may cross the barrier between information to providing medical advice. And it has to do with the number of factors implied or expressed consent, foreseeable reliance upon the patient on the advice, but it's really setting independent. You know that asked for information at a cocktail party, there are enough aspects of the duty in the duty breach causation and damages analysis under the law that it's easy to form a physician-patient relationship and hard to dissolve it. So a couple of things. The more it becomes tailor advice with medical history, your evaluation, tests if you're aware of them, and your professional judgment may in fact be now moving toward medical practice rather than information, and then closing the discussion, giving an opinion, and foreseeable reliance by the patient with the expectation that they'll act in reliance on the advice may end up being construed as the practice of medicine. Not to say you might not want to give medical advice online, but then you want to know whether or not your malpractice coverage, your liability coverage covers it, and you want to be able to practice online medicine to the degree that it can be best practiced. And there are some people in this room who say that can't be. But there's no single factor that's decisive. It's really a case-by-case analysis. And having disclaimers that talking about medical issues or consulting with a physician online isn't medical advice won't really withstand judicial scrutiny. So again, this is just something to be aware of in my cautions. So your new patients, they don't use email, they don't use computers, they use their cell phones. And that may actually be a good thing when talking about the democratization of the patient-doctor relationship, because a number of indigent patients don't have access to computers, but they do have access to cell phones, and so they may have access to social media. So it's one of these conundrums that patients actually, some patients may be more accessible as a result of their being able to access this information by their phone. But this new generation, you may be talking to them through Facebook rather than by email. The concerns that we had in thinking about email in the first decade of this century may now become concerns about the communication between doctors and patients through social media. And if that would happen, there are a number of things that would need to be addressed. We happen to address these in an article in Health Affairs in which we really were looking at email interactions and web communication between doctor and patient, not really social media, because at the time that we first looked at this, social media had not really developed. But you have to address conflicts of interest in any kind of interaction, and I think that's quite important even in advising or giving information online. You need to meet the duty of care and the standard of care. You also have to be aware of the importance of physical examination. It's great to put out photos of a young child and figure out from the photos that it's Kawasaki disease. None of those doctors examine the patient, however, or none of the people with the opinions examine that patient. And the importance of the physical exam, as Abraham Verghese tells us, is that his quip is that the patient sitting in front of you is really the eye patient, and the real patient sitting in your online medical record or in your medical, your electronic medical record system. Obviously, he's being ironic, but the reality is that physical examination, is still quite important in that encounter. The quality of any online communication, physician identity, we argued, needs to be absolutely available. You shouldn't have anonymous physicians taking care of patients. And obviously the patient needs to give informed consent, perhaps not just to a procedure or a test, but also to the medium itself. And of course, the ever-present issues of privacy and confidentiality. So a few social media recommendations for physicians. Obviously, first, do no harm. Maximize those privacy settings, that so-called dual citizenship. And I think checking your online presence through self-searches is a great idea. I have done it, and I'm sometimes surprised what is ranked higher than other things that show up there. And the regular discouragement about your patients using social media to interact with you, although I do put a little proviso in here. Some physicians, because patients only communicate through Facebook, say you will have to communicate with patients through Facebook. So it's just inevitable that you will. And don't disclose that HIPAA information. So setting standards. You're doing it wrong, something you don't want to hear under light anesthesia, one surgeon to another, but training institutions are for people to learn. So a few things that I say at the other end of the keyboard is the world, right? So you can say something in your office, you can say something in the hospital, and there are maybe people here who may hear this, you may be apologizing for something that you did to a small group of people, but at the end of that keyboard is essentially the rest of the online community, and you will make unintended tweets and posts. I happened to send something to Abraham Verghese personally, and I ended up tweeting it so you can see it. If you want to follow me, you'll see what I said to him. And you'll just make mistakes if you're wading in like I am. Once so if you are going to be making mistakes, be careful. Once you put it out there, you can't take it back. You can try taking it down, but it's kind of measure twice, cut once. So consider posting twice, post once, something similar to what Dr. Poe said, especially for us newbies in social media.